Okay, we're going to study the sacrum. Sacrum, it is a fusion of 5 bones. It is part of the vertebrae. It is a fusion of 5 bones. It consists of sacral 1, 2, 3, 4, 5. Okay, it is now a one bone. Now, it has a base, an apex, a sacral canal, and it has 4 surfaces: pelvic or ventral surface, dorsal or posterior or dorsal surface, and two lateral surfaces. Now, let's consider this. We'll first talk about the base, then apex, then we'll go into the surfaces, and then ultimately we'll go to the sacral canal. Okay. At first, when we talk about the base, it is formed by the upper surface or the superior surface of the first sacral vertebra. Okay. The anterior margin, it is called the sacral promontory. Okay. It is formed by the anterior margin of the body of the first sacral vertebra. This is called a sacral promontory. The base, it has 3 parts: a central part or the middle part, and it has 2 lateral parts, the right and left lateral parts. At the central part, we have the sacral promontory, the anterior margin. It articulates with the base of the it articulates to the body of the fifth lumbar vertebra. Articulate করে it forms the lumbosacral joint. Which is a secondary cartilaginous type of joint. It has 2 lateral parts, the left and right lateral parts. The lateral parts, they have smooth medial part and rough lateral parts. Okay, smooth medial, these are in relation with 4 structures: from medial to lateral: sympathetic chain, lumbosacral trunk, then we have iliolumbar artery and obturator nerve. Okay. And the rough lateral part, we have the anteriorly we have the origin of iliacus muscle, and posterior part, we have the attachment of the lumbosacral ligament. Okay. Now, moving on, that was about the base. Okay. Now, at the anterior surface, let's talk about the apex first. The apex, it is narrow, blunt. It has an articular facet which articulates with the first coccygeal vertebra. It is also a secondary type of cartilaginous joint, and it is formed by the inferior surface of the inferior surface of the fifth sacral vertebra. Now, the anterior surface or the pelvic surface, it is smooth and concave. At the middle, it presents 4 transverse ridges which indicate 1, 2, 3, 4 transverse ridges which indicate the fusion of the 5 sacral vertebra. Okay. Now, let's talk about the relations. At the midline, in relation, there is the median sacral vessel, and at the medial margin of the anterior sacral foramina, we have the sympathetic chain Now, here we can see some foramina. These are the anterior sacral foramina. These transmit the ventral rami of the upper 4 sacral spinal nerves, and a branch of lateral sacral vessels. Now, attachments, we have the attachment of there was another relation we missed out. For the sacral 2.5, we have the relation of the sigmoid colon. Sigmoid colon and few coils of small intestine. Okay, sacral 2.5, sacral 2 and half, upper sacral 2 and half, and the lower half, they have the relation of the rectum. They have the relation of the rectum because the rectosigmoid junction, it is at the sacral 2.5. It's easier to remember. Okay. Now the bodies of the middle three sacral vertebra, sacral 2, 3, 4, they provide the origin, E-shaped origin of the piriformis, E-shaped origin of the piriformis, and in the upper part we have the origin, upper lateral part we have the origin of iliacus, and lower lateral part we have the origin of the coccygeus muscle. That's the anterior surface. Now coming back to the dorsal surface or the posterior surface, we have the origin of muscles. We have crests, we see. Now this surface, it is rough and convex, and it has three crests: the median crest, the intermediate crest, and the lateral crest. The median crest, it is formed by the fusion of the spinous processes of the sacral vertebra. In the intermediate crest, it is formed by the fusion of the articular processes of the sacral vertebra, and they present four tubercles, 1, 2, 3, 4 tubercles. Now 4 tubercles, and the fifth inferior articular process or inferior articular process, it is not fused, so it presents the sacral cornua and a U-shaped. Below the fourth tubercle we have the sacral hiatus. What does the sacral hiatus transmit? The sacral hiatus transmits the fifth pair of sacral spinal nerves, one pair of coccygeal spinal nerves, and the filum terminalis. That was the sacral hiatus. Okay, sacral cornua, sacral hiatus. Now at the dorsal, the lateral crest, the lateral sacral crest, these are formed by the fusion of the transverse processes. Now we have the dorsal sacral foramina. These are also four pairs. The dorsal sacral foramina, these transmit the dorsal rami of the upper four spinal nerves. Now coming to the lateral the attachment here between the median and lateral crests, we have the U-shaped origin of erector spinae muscle, and the within the U shape we have the origin of the multifidus muscle. Okay. Now coming to the lateral surface. The lateral surface, it has upper wider and lower narrower part. The upper wider part, it can be divided into anterior and posterior parts. Anterior articular surface, which is an inverted L-shaped articular surface, and posterior rough part, which is the sacral tuberosity. Okay. It has a medial bend, which is known as the inferolateral angle, which provides the attachment of the lateral sacrococcygeal ligament. Okay, the upper wider part we already talked about. This is an inverted L shaped, which articulates with the ilium to form the sacroiliac joint, which is a plain type of synovial joint. And the posteriorly, this rough part, it provides attachment to the interosseous sacroiliac ligament, which also forms another component of the sacroiliac joint, syndesmosis type of fibrous joint. Okay. And at the inferolateral angle, it provides a lower narrower part. It provides attachment from behind forwards. We have the gluteus maximus, sacrotuberous, sacrospinous ligament, and coccygeus muscle. Okay, behind forwards. If we talk about, we talked about sacralization. in lumbar vertebra. Let's talk about lumbarization in sacral vertebra. In this case, the first lumbar vertebra, it fuses with the first sacral vertebra, it fuses with the first lumbar vertebra. That's lumbarization of sacral vertebra. Okay, I think that's pretty much it. Okay, we did not talk about this sacral foramen, sacral canal. The sacral canal, it is formed by the fusion of the sacral vertebral foramina. The sacral canal, it transmits what the fifth lumbar vertebra or the vertebral foramen of fifth lumbar vertebra carry. It consists of the cauda equina with meninges, the phylum terminalis, and in addition with that, it also transmits the sacral nerves and the lateral sacral vessels. That's it. That's the sacral foramen. I think we are done with that. Do we have anything else? Let's just check. Okay, now we are done. We're done. Yep, we're good to go. Thank you.